All right, class. So welcome to day 2 of physiology. We're just going to go through what you have due this Sunday, which is September 5th. So we just started we had our first kind of introductory class on Tuesday, and now we'll get through chapter 1 tonight. But on Sunday this week, remember that all of your assignments, whether it's a test, a quiz, a lab, anything is always due on Sunday at midnight. And you already have several assignments due this Sunday: the syllabus and welcome quiz, the Who Am I discussion, and the Proctorio practice quiz, which you need to download the Proctorio extension for. If you have the Proctorio extension from a class previously, you might have to remove it and re-download it because Proctorio often updates their extension. And here's just a link, a YouTube channel link to all our recorded classes. So just always come there. If you ever don't show up to a live session, just go to our YouTube channel to see the recording of that session that I'll usually post either tonight or by tomorrow for sure. So here's module 1. We're going to go through chapter 1. Module 1 is, again, we have about 4 chapters to get through. Chapter 1 is an introduction to anatomy and physiology. And as you'll see, we might go through it rather quickly because I'm hoping it'll be a little bit of a review for you. But what else did I want to say? You have a lecture quiz. There's one more thing due. Yes, you have your first lab is also due by this Sunday. So I'm kind of throwing you right into the Labster simulations. I would close out all your windows, run Labster using Firefox or Google Chrome. It's basically like a video game type simulation. Give yourself 1 to 2 hours to complete it. You have unlimited attempts to do it. So you'll answer many, many questions as you work through the material, but you can do it over and over again. And whatever you get right, out of so many questions, it'll convert that out of 10 points. And it'll automatically be graded. So for those labs, you don't have to submit a lab report, but it will take you some time to work through the simulation. And you can work on that case study already. Everything else is set to go, but I will pull up our chapter 1 PowerPoint. And again, as we are lecturing here, I never offer study guides for anything, but I try to point out kind of some things you should focus on for your tests or quizzes. That's a great question. Someone asked, if you stop Labster and go back the other day, will it save where you stopped? I don't think it will because you never have a login information for it. Oh, it will let you resume. I think as long as you keep the window open, it will. But if you close out the window, will it still let you resume? It could. That's great, Valerie, if it does. Good. Thanks for helping each other out with that. All right, so let's get started on chapter 1. This is kind of an easy introductory chapter. I wish all the physiology chapters would be this easy, but hopefully you guys will recognize a lot of this material from anatomy. In terms of what you need to know from chapter 1, you kind of have to know it all because I'm hoping you guys remember or can kind of pull it out of the corners of your mind, some of this anatomy information. This is all very important information too in this first chapter that you will take with you no matter what healthcare career you might go into. So the human body, learning and understanding the anatomical terminology will allow you to communicate accurately with your colleagues in the health sciences. And that's why you took a whole class in anatomy. You guys know that anatomy is the study of structure. So identifying all the different body parts, their relationship to each other. And physiology is the study of function of body parts and how they work to carry out life-sustaining activities. And if my audio is ever kind of off, let me know. And I see I just enabled the audio, so hopefully that helps for you guys too. There's topics of anatomy. Gross or macroscopic anatomy is the study of large visible structures. Regional anatomy looks at all the structures in the particular region. Systemic anatomy looks at just one system at a time. And you guys probably, your anatomy classes were systemic anatomy. So you guys learned all about the cardiovascular system first and all the structures, the nervous system, the muscular system. That's how we'll kind of tailor this class. With physiology, we'll look at systems one at a time. And then surface anatomy looks at internal structures as they relate to overlying skin. So these are visible muscle masses or veins seen on the surface, and then you know what could be lying below them. So an example of this is your Adam's apple. In males, it's a lot more prominent due to testosterone, but that is what you're touching is your thyroid cartilage. So that's looking at surface anatomy. Microscopic anatomy deals with structures too small to be seen by the naked eye. Cytology is the microscopic study of cells, and histology is the microscopic study of tissues. And then developmental anatomy studies anatomical and physiological developments through life, with specifically embryology is all the study of the developments before birth. And you can take classes just completely on embryology. If you go on to future graduate school, medical school, physical therapy. So embryology is a kind of a whole nother, layer or topic of anatomy. To study anatomy, one must know anatomical terminology and be able to observe, manipulate, palpate, and auscultate, which is here. Here are subdivisions of physiology. So this is how, now you kind of made it through anatomy, this is how we'll subdivide physiology. And especially in this course, we'll be looking at organ systems. So your renal, cardiovascular physiology. It often focuses on cellular and molecular levels of the body as well. And physiology will look at how the body's abilities are dependent on chemical reactions in individual cells. So physiology will dive a little bit more into the chemical reactions that occur on a cellular level. To study physiology, one must understand basic physical principles like electrical currents, pressure, and movement, which we will get into, as well as basic chemical principles. So we get a little more into chemistry and physics in physiology, but not too much. It'll still be interesting. As you know, A and P are inseparable because function always reflects the structure. What a structure can do depends on its specific form, and this is known as the principle of complementarity of structure and function. So at LBCC, you guys take an anatomy class and you take physiology, but at a lot of colleges, some colleges are just moving into taking anatomy and physiology at the same time. So you get kind of a whole year of A&P1 and A&P2, and that's because they're so closely related. So here we have kind of the complementarity of structure and function, just looking at your incisor teeth. Make them ideal for cutting like scissors as you're chewing or masticating, which is mastication chewing. And the flat surfaces of your molars, which is a structure identity, makes them ideal for grinding. So kind of getting the food pieces even stronger or smaller, which is the function. The human body is very organized from the smallest chemical level to the whole organism level. And this structure of organization in the body is one you guys should be familiar with. We start at the chemical level, which are all of your atoms, molecules, organelles. They form the cells, which is the cellular level. Different cells come together to form tissues. So tissues are made up of specific types of cells, maybe a kind of a collaboration of cells. Tissues come together to form organs, which contain 2 or more types of tissues. And then organs come together to work closely together to form one of the 11 organ systems in the body. And then all 11 organ systems will form the organism if we're talking about a human. So these are all the organ systems combining to make the whole organism. And I think we show pictures of these levels of structural organization. And again, you should know this order of structure. If you took me for anatomy, I'm really into this organizational structure. So you should just be able to identify and put these kind of structural organizations in order. All right, requirements for life, necessary life functions. So maintenance of life involves maintaining boundaries between an external and an internal environment, being able to move, respond to stimuli, digest food, metabolize food, so take that food and turn it into energy that our body will use, and then excrete waste, reproduce, so kind of send down the line your genetic material as well as grow. And these necessary life functions are all described here, maintaining boundaries such as the plasma membrane or the skin, movement, like your muscular system allowing movement. We'll talk about what contractility will look like. This is the movement at the cellular level. Responsiveness, responding to a stimuli so that you're able to withdraw a part of your body when it feels pain that's necessary for life. The control of breathing rate when you're responding to different activities. Digestion, just breaking down what you eat and then absorbing simple molecules into the blood. Metabolism, all chemical reactions that occur in your body cells. This is the sum of all catabolism, which is breaking down molecules, and anabolism, which is the synthesis of molecules. And then excretion is the removal of wastes from metabolism and digestion. So the excretion, the wastes that our bodies excrete are urea, which is when proteins are broken down, carbon dioxide from metabolism, creating energy, and feces, which is anything that our gut cannot absorb. Reproduction, dividing of cells for growth and repair. So that's at the cellular level. All of our cells need to reproduce because all of our cells are dying. So we need to make more cells. And then at the organismal level, reproduction is the production of offspring. So continuing that organismal race. And then growth is any increase in size of a body part of an organism. Humans are multicellular. So to function, individual cells must be kept alive. Organ systems are designed to service the cells, and all cells depend on organ systems to meet their survival needs. And there are 11 organ systems in the human body that work together to maintain life. And this looks at all of kind of an example of the interrelationship among the organ systems. So for example, here's our digestive system taking in nutrients, and those nutrients are transferred or transported throughout the body using the cardiovascular system. Your cardiovascular system distributes these nutrients. Your cardiovascular system distributes oxygen. It delivers wastes and carbon dioxide to disposal organs. So it's connected to your respiratory system, which disposes carbon dioxide, which is a waste product. Your cardiovascular system brings waste products or all the blood to the urinary system, where the urinary system, your kidneys will filter the blood. And you can kind of see just an example how these organ systems all work together to maintain life as well. These next few slides take you through the 11 organ systems, and you will need to know well these 11 organ systems and their general description of each. So you will have several questions on your first test about the organ systems. Integumentary system is your hair, skin, and nails. It forms your body covering, protects deeper tissues from injury, helps to synthesize vitamin D, houses lots of cutaneous receptors. The skeletal system protects and supports your body, organs, and provides a framework that muscles can use or attach to cause movement. Blood cells are also produced in your body's bones. Muscular system allows manipulation of the environment, locomotion, facial expression, so helping movement. The nervous system is the fast-acting control system of the body. It responds to internal and external stimuli to help to maintain homeostasis of the body. Here's the endocrine system, which is my kind of favorite system because it contains all these teeny tiny glands throughout the body that secrete hormones that regulate literally all processes of the body: growth, reproduction, metabolism, body temperature. I don't know, I've always just liked the endocrine system because you can't see anything that's happening, but it just controls everything. Cardiovascular system transports blood, which carries oxygen, carbon dioxide, nutrients, and other waste products. It consists of your heart and blood vessels. The lymphatic system, also, we kind of combine that with your immunity or immune system because it picks up fluid leaked from the blood vessels and returns it to the blood. It disposes of extra debris in the lymphatic stream, and it houses white blood cells, which are involved in immunity, so attacking anything foreign. I kind of think of your lymphatic system is your body's defense system, but also kind of the catch-all system. So anything else that's kind of leaking out, the lymphatic system kind of takes in all this extra fluid that's leaking from blood vessels. The respiratory system takes in carbon dioxide, takes in oxygen and removes carbon dioxide. Carbon dioxide is what your body's constantly, or your body's cells are constantly creating as a waste product when your cells take in glucose and turn it into energy. So CO2 is a big waste product that needs to be expelled through the respiratory system. Digestive system breaks down food into absorbable units that enter the blood for distribution to body cells, and anything indigestible will pass through. Urinary system eliminates nitrogenous wastes, regulates water, electrolytes, pH. It filters all of your blood. And then we have male and female reproductive systems. Basically, the overall function in the reproductive system is to produce offspring. The testes, which are the male gonads, will secrete testosterone and then have a series of ducts that will transfer the sperm, eventually, maybe possibly into the female reproductive system to produce offspring. And there's the female reproductive system, including the mammary glands, as well as the duct system, and then producing the female. The gonads are the ovaries, and then the gametes, excuse me, I was trying to find the word, are the eggs. So we'll go over those body systems, but you should know kind of a brief description of each. Other survival needs, so humans need several factors for survival that must be in appropriate amounts, or too much or too little can be harmful. And these are nutrients, oxygen, water, normal body temperature, and appropriate atmospheric pressure. I don't go through these so much in your test, so I'll let you guys kind of read through these on your own. We'll go over a lot of these nutrients, some of these chemicals for energy and cell building. We'll go over in the chemistry chapter, how carbohydrates, proteins, fats, and minerals and vitamins are all essential for nutrients. Oxygen is essential for the release of energy from foods. The body can survive only a few minutes without oxygen. Homeostasis, you should understand homeostasis well. This is the maintenance of a relatively stable internal condition in the body despite continuous changes in the environment. It's a dynamic state of equilibrium, which means it's trying to maintain an equilibrium, and it's always readjusting as needed. And homeostasis is maintained by contributions of all the organ systems. The body must be constantly monitored and regulated to maintain homeostasis. Your nervous and endocrine systems play a major role in maintaining homeostasis, and variables that can change, and a variable is any factor that can change in the body that your body will try to maintain kind of constant. Your blood sugar, body temperature, and blood volume are a few. And the homeostatic control of these variables involves these three components, which you should know: the receptor, the control center, and the effector. The receptor is the sensor that monitors the environment. It will respond to stimuli, which is anything that can cause a change in body temperature, glucose levels, heart rate. The control center then will determine the set point at which the variable should be maintained. It will receive input from that receptor when a change is detected, and then it will determine an appropriate response. So for example, you have receptors in your skin to maybe monitor body temperature or other areas in the body. And then the control center in the brain will say, all right, we have an increase in body temperature. We're going to send out a response to your sweat glands in your skin to cause them to sweat to try to cool down your body. Then the effector receives that output from the control center. It provides the means to respond, and the response will either reduce the stimulus, like negative feedback. So a negative feedback mechanism will change or go in the opposite direction of the initial stimulus. So if the body is getting hot, the negative feedback will try to cool down the body, or the response can enhance the stimulus, and that's a positive feedback. So for example, if you cut yourself accidentally, your blood will form a clot, and it'll continue to recruit more and more clotting factors in a positive feedback response as an enhancing stimulus until the clot has completely kind of stopped the blood from leaking. Negative feedback, though, is much more common. The response reduces or shuts off the original stimulus, so the variable will change in the opposite direction. And an example of this is body temperature, which is a nervous system mechanism, the regulation of blood glucose, which is an endocrine system mechanism. An example of negative feedback in terms of blood sugar. So the receptor might sense an increased blood glucose level in the blood. That's blood sugar. The pancreas then is the control center, and that will secrete insulin into the blood. And insulin will cause the body cells, then this is the third part of the control system, which are the effectors, to absorb more glucose, which will then decrease blood glucose levels in a negative feedback loop. This interaction among the elements of the homeostatic control system, maintaining a stable internal condition, this exact picture, you'll have a question like this on your lecture exam. And knowing these different steps and how they all will kind of control this negative feedback mechanism is important to know. So I'll let you guys study that slide on your own too. And this takes you through each one individually. Here's body temperature, an example of negative feedback. So for example, the receptor temperature sensitive cells in the skin and the brain will notice a body temperature rising. The control center, the thermoregulatory center in the brain, that might be a test question. That will be what kind of receives the input and then send out a response to your effectors to sweat, to try to cool down. Oppositely, if you get really cold, the thermoregulatory center in the brain will tell your skeletal muscles to shiver, to try to move, to try to increase your body temperature. And then positive feedback, the response enhances or exaggerates an original stimulus. It could exhibit a cascade or amplifying effect as feedback causes the variable to continue in the same direction. Some examples are the enhancement of labor contractions by the hormone oxytocin. It's released by the pituitary gland when labor contractions begin, and more oxytocin just continues to get released by your pituitary gland in a positive feedback loop. And it continues until what happens? Till the baby is born. So your oxytocin levels get really high until the baby comes out. Platelet plug formation and blood clotting refers to the clotting of a blood vessel if damage occurs. So here's a look at a positive feedback mechanism regulating the formation of a platelet plug that we talked a little bit about. And this takes you through the 5 steps. Imbalances, disturbance of homeostasis can increase the risk of disease, and this will contribute to changes associated with aging. So when you age, the control systems become a little less efficient. And if negative feedback mechanisms become overwhelmed, destructive positive feedback mechanisms could take over, such as heart failure. All right, so anatomical terms. So this is kind of, we're getting into the part that will be a review, but you should still have a very good understanding about this. I'm going to ask you what anatomical position means, where you're standing up straight, feet slightly apart. The big one is palms facing forward with thumbs pointing away from the body. You should remember some of the directional terms that describe one body structure in relation to another. The direction is always based on standard anatomical position and the person in anatomical position, their right and left side. The right and left refer to the body being viewed, not the right and left side that you guys are looking at. So think of it as a patient lying in a hospital bed, and it's the patient's right and left side. So these orientation and directional terms, I test you guys on this again, because I guarantee if you guys are writing charts, writing in notes as a nurse, a physical therapist assistant, you guys will be using these orientation and directional terms, I promise again, in your careers. So be sure to review these. You know what superior means, closer to the head, inferior, closer to the feet, anterior. Another word for anterior is ventral, posterior is dorsal. Medial and lateral have to do with close to the midline. Medial, lateral is away from the midline. Intermediate, I won't test you on too much. It's describing between a more medial and a more lateral structure, but don't worry about that one. Proximal and distal. Proximal is closer to the origin of the body part or closer to the trunk. Distal, think of distance, kind of the tips of your toes or the tips of your fingers. So, and then I really like these slides because they give you examples of each. So for example, the elbow is proximal to the wrist, and that's because your elbow is closer to the point of attachment, your shoulder, than your wrist is. The knee is distal to the thigh because it's further away from the point of attachment of the thigh. Superficial and deep. Superficial is more external, such as the skin. Deep is internal. So for example, the lungs are deep to the skin. The regional terms, you should know well what axial and appendicular mean. Axial is the head, neck, and trunk. Appendicular are your limbs. And different regional terms will also designate specific areas within these body systems. These regional terms, I do think I have like a matching question or a couple of questions. I'm still kind of revising your test, but there will be some questions on these regional terms. And you guys have taken anatomy before, and you know that anatomy is like learning a new language. And once you learn the language of anatomy, when I tell you what the axillary region is, you know that that's the armpit region. Inguinal is the groin, fibular, tarsal, metatarsal, digital, oral is the mouth, orbital is the eye, frontal region is the forehead, because you know the frontal bone and the frontalis muscle are on your forehead. So take a little bit of time reviewing some of these body regions because there is a question on your lecture exam on that too, both front and back. I don't test all like 100, but I do pick out a few and kind of have formed like a matching question. I'm giving you like all the questions on your test. So hopefully, yeah, you just have to study. Body planes and sections, there is a test question on body planes. So knowing what the different types, the three most common planes. And a body plane is a surface along which the body or structure may be cut for anatomical study. And this is important because if you ever read an MRI or a CAT scan or even an X-ray, just to know what you're looking at, because a sagittal cut through the body will show you a different inside look versus a frontal cut or a transverse cut. A section is a cut or section made along the body plane, and it's always named after the plane. So a sagittal cut will result in a sagittal section. And I'll show pictures of this. A sagittal plane divides the body vertically into a right and a left part. It can produce a sagittal section if cut along this plane. You can have a mid-sagittal plane right down the midline or a parasagittal plane that's slightly off center. And I'll show a picture after we get through all of them. The frontal coronal plane divides the body vertically into an anterior and a posterior part. So if you kind of cut right down the side and then separate out a front and back and then open up, that's what you would be looking at, a frontal cut. A transverse horizontal plane divides the body horizontally into a top and bottom, or superior and inferior. So this produces a cross section. An oblique section we don't refer to as much, but this results of a cut at an angle other than 90 degrees. And here are just planes of the body with corresponding MRI scans. So again, an MRI is an amazing medical tool because it takes a complete look at the inside of the body. And then what the tech will do, or the physician or medical professionals, they will take different cuts through the body, whether it's a mid-sagittal plane cut, a frontal cut, or a transverse plane. And by doing that, they can see different sections of the body and different organs to try to identify tumors, cancer, anything that might be broken. So MRI is a great, medical amazement. All right, body cavities and membranes. So as you know from anatomy, that your organs aren't just hanging out all willy-nilly, kind of floating by each other. They're all contained in a cavity, and your body contains several cavities that are closed to the environment. And these cavities provide a degree of protection to the organs within them. We kind of divide them into two sets, the dorsal and the ventral, the front and back. The dorsal body cavity protects the nervous system. So we divide your dorsal body cavity, dorsal means posterior, into your cranial and vertebral cavity with the brain and the spinal cord. And this is just a good kind of review of the body cavities. The dorsal, you can see that in the posterior, and the ventral body cavities we divide into the thoracic and abdominal pelvic. The thoracic body cavity would divide into the pleural cavity with the lungs, the pericardial cavity with the heart, and then the mediastinum includes the pericardial cavity, as well as all the major blood vessels, the trachea and esophagus that come off some organs. Abdominal cavity, a lot of digestive. Viscera means organs. And then the pelvic cavity contains bladder, reproductive organs, rectum. So this kind of takes you through the ventral cavity. Again, organs are collectively called viscera. You should know the subdivisions, what is in each subdivision. So I'll let you guys kind of review that on your own. There could be a test question about body cavities, abdominal cavity, pelvic cavity, and what is in each. And then as we go through these lectures, every once in a while, we'll get to a clinical significance, and they're called homeostatic imbalances. And this is the first one. And this is a problem that occurs when structures stray into neighboring cavities. So normally your organs and structures want to stay in the cavity they're supposed to be in. But in the case of a hiatal hernia, this is where part of the stomach can protrude through the diaphragm into the thoracic cavity. So up into the thoracic cavity, this can push stomach acid into your esophagus, causing heartburn, and severe cases of a hiatal hernia could need surgical repair. Then some of the membranes. So these are the coverings in the cavities. Serosa is also called the serous membrane, and this is a thin double-layered membrane that covers the surfaces in your ventral body cavity. So in the anterior side of the body cavity, like the thoracic and abdominal pelvic cavity. Parietal serosa lines internal cavity body walls. So the cavity itself is lined with what we call parietal serosa. And then the visceral serosa, whenever you see the word visceral, remember that has to do with organ. Viscera is an organ. So a visceral serosa will cover organs. These double layers are separated by a slit-like cavity filled with serous fluid, and the fluid is secreted by both layers of the membrane. And then each kind of serous membrane is named for the specific cavity and the organs that are associated with it. So the pericardium has to do with the heart because it has that suffix cardia in it. Pleura has to do with lungs, and peritoneum is the serous membrane that covers the abdominal cavity. And your case study has to do with pleurisy. So it has to do with a problem in the lungs. In your case studies, often you guys will have to find outside sources. Your textbooks might be a source, but you might have to find even other sources to do your case studies, just so you know. So here is how like a serous membrane, yeah, question.
Hi, Professor. Sorry to interrupt you. I just had a really quick question. Like you said, I do remember learning all of this in anatomy. I just had a really quick question on the parietal serosa, because I know further on in one of the, this one actually, you know how it points to, so the outside of the balloon is like the parietal serosa, but how in the definition for parietal serosa, it says it's like, oh, okay. So it lines the outside of the internal cavity, not the inside, right? The parietal serosa?
The parietal serosa, so in this case, it's the parietal pericardium. The pericardium is the serosa in this case. It will line, so the cavity that your heart sits in is called the pericardial cavity. And that cavity, the inside of the cavity is lined with the parietal pericardium.
Okay. So, but it's like, because you know how here in the diagram, it's like I guess you would say the outer surface of the cavity, like right there. I thought it was pointing. Oh, okay.
Yes. Yeah. It's like the outer surface of what you're seeing, but think of like, yeah. And the easiest way to think of it is the visceral serosa, or in this case, we're talking about the heart. So the visceral pericardium covers the heart itself. And then the parietal pericardium lines kind of the hole that the heart sits in.
Okay, got it. That makes sense.
Yeah. I know it is a little confusing. No problem. Yeah, I'm always happy to, yeah. So here we have serous membranes can become inflamed as a result of an infection or other cause. This is where you get pleurisy or peritonitis. Normally, the smooth muscles can become rough and can even stick together, which can result in excruciating pain. And again, this can be due to a result from an infection or something else. So here we have pleurisy, just to talk about your case study, or peritonitis. Whenever we see the word itis, that means inflammation. So you'll see you can have hepatitis, which is inflammation of the liver. And this is an inflammation of the peritoneum, which is the serous membrane of the peritoneum cavity and the abdominal cavity. So So here are ventral body cavities. Let's go through some quadrants, how we divide the abdominal pelvic cavity. And dividing kind of your abdominal pelvic cavity into quadrants is really important, primarily for medical personnel, so they can diagnose problems if someone comes in and presents with pain in a certain quadrant, or just for surgical reasons, they know where to make an incision. These quadrants might be listed on a chart for someone complaining of pain. The abdominal pelvic region is sectioned into these four quarters, right, left, upper, lower quadrant, and they're shown here. And there might be a test question asking you, the gallbladder is in what quadrant, or the appendix is in what quadrant. And you should also know the 9 divisions called regions of the abdominal pelvic. These resemble more like a tic-tac-toe grid. There's 9 of them. They're used primarily by anatomists, so people who are studying anatomy, but can also serve as a diagnostic tool. Again, if someone presents to your ER and they have pain in one of these 9 quadrants. And I know this is kind of a lot to study, but hopefully if you remember anatomy well, I think the test question asks you and I don't remember what organ it was, but you should know well where the organs are and which quadrant they lie in. So you might need to study these quadrants a little more. The umbilical region is easy. That's the one in the middle. Epigastric is kind of above the stomach, so that'll be above umbilical. Pubic region, right and left inguinal. Remember, inguinal is just groin. So again, knowing those body regions will help you remember the names of these regions. Right and left lateral or lumbar regions, and then right and left hypochondriac. And then understanding more or less what organs lie in each. I'm not going to ask you like, which region does the small intestine lie in, because it lies in several. It'll be really clear, like it'll be clear. Yes, so and even, appendix, and I see, so my words are like right in front. Yeah, the appendix, I would call it the right inguinal. Yes, good question. It's kind of hard to see. So I'm telling you to study this, and it's like impossible to study. I just study more of the region names, and I promise you the question on the lecture exam will be easy too. You'll know. That's the best I can tell you. Sorry, but it'll be clear. Wrong site surgery. These are critical errors that occur, including amputation. So amputating the wrong limb that results from confusion about right versus left or poor understanding of terminology. So this is why we go over it again and I test you guys a lot on it, because this still happens today. Surgeons will amputate the wrong limb because they can't remember right versus left. Oh, this must be the right arm, but it's always right and left versus on the anatomy. And mastering this terminology will help to eliminate these blunders. So that's why I spent some time reviewing this. Other body cavities, I'll let you review some of these on your own: oral, digestive, nasal, orbital with your eye, middle ear cavities, synovial cavities. Those are not exposed to the environment. Those are your joints, like your elbow and your knee, synovial cavities. And that takes us through the introduction. So I'm going to go ahead and stop the recording, and then I'll answer some questions as well.